How do you feel the landscape of healthcare is changing, and any innovative ways of management and diversity and inclusion?
Yeah. Well, I think there's parallel things going on right now.
Yes.
The big entities, the Kaiser Permanentes, the big hospital systems, the insurers are dabbling in all this type of thing. But I think the breakaways are going to be the disruptive companies that are out there that are doing things like behavioral health and telemedicine,
Yes.
okay, and those types of things. So I think a lot of those startups are going to be the ones that really disrupt the industry, and then they'll get bought up by the big guys, and then
Gotcha.
the big guys will adopt it. I mean, that's the
Gotcha.
easiest way for the big companies to adopt it. So I think that's a biggie. But I don't think we've really solved the value-based purchasing. Having spent 6 years with Kaiser Permanente, which
Yes.
is the model everyone's trying to copy, at least on the provider side.
Yes.
They're far ahead of everybody else, and in terms of wellness prevention, and actually they're out there working with these startup companies to try to even provide additional support for Kaiser Permanente members, so that they can keep them out of the ORs, or keep them out of the hospitals, keep them out of the emergency rooms. And
Yes.
that's key. I think one of the things I've always thought when I was at Kaiser is, if we have a member in the hospital, that's a failure on our part.
I understand.
We got to keep them healthy.
Yes.
So another thing that I'm beginning to see is that this whole issue about social determinants of health, and finally I think we're beginning to see that hospitals, health systems, insurers are beginning to say, we better start to address housing, the environment,
Yes.
education as a factor in the healthcare, and look at it as an investment in our member, if you will,
Yes.
or the person we're responsible for. So I think there's a lot of things going on there, but this whole notion of value-based purchasing, if you go across the country, here in California we have a lot going on already.
Yes.
People are taking on risk, they're doing it. If you go to other parts of the country, they're wedded to fee-for-service medicine, and they will not give it up.
Yes.
Okay? So we have a generation of change that has to go on before we get to the ultimate, value-based purchasing, where providers are really taking responsibility from cradle to grave, the social aspects of health, including healthcare and wellness and so forth.
Wow.
So that's where I think is going on.
Health Innovators Club.